we are going to need to look into chronic diseases in this video, looking at things like cardiovascular disease, hypertension, cancer, diabetes. How does nutrition help any of these? So really, what is a chronic disease? Well, obviously chronic means long-term. But these long-term diseases have different risk factors associated with them. Genetics plays a role. Obviously, you can't change that. But other risk factors, obesity, hypertension, dietary and lifestyle choices all can impact these different chronic diseases. Let's start with cardiovascular disease. Now, according to the CDC, the cardiovascular disease is the leading cause of death in the US. Now, usually it's going to start with atherosclerosis. Atherosclerosis is going to be the hardening of your arteries due to plaque buildup on the inside. A lot of this comes from a dietary basis. But once you start to build up that plaque, you start to harden those arteries, then normally that increases blood pressure. Increasing blood pressure puts more strain on the heart muscles. Because if the blood pressure is elevated, the heart needs to constrict a little bit stronger to push the blood out of the heart. Well, as that occurs then, you can also have weakening of the arterioles. Arterioles are just the smaller arteries, a little bit thinner on the walls. But by weakening those even further, it has the risk of bursting. Now, if you burst an arteriole, let's say up in the brain, looking at an aneurysm, obviously not good. The plaque that lines these arterioles, or the arteries for that matter, this plaque that builds up can sometimes break apart or rupture. The rupturing of this would trigger the body to cause a clot to occur because it thinks there's damage has happened. Well, if you create this clot inside the blood vessel, because that's where the plaque is, you can either have what's called a thrombus or an embolus. Now, a thrombus is going to be a stationary clot inside the blood vessel. It's not moving, just it's there. This will have an impedance on blood flow, can cause more turbulence, and basically cause destruction of that vessel at that point if it keeps building and building. The embolus, on the other side, is going to be a moving clot. So if it starts off and builds in one artery, but then starts to flow with the blood, well, as blood flows from larger vessels to smaller and to smaller, eventually it reaches the capillaries, very small vessels. That clot, that moving clot, that embolus, might get stuck or lodged there. If it gets stuck, it blocks all blood flow through that vessel. Obviously not good either. So why are we talking about this with nutrition? That's because what your diet is, what your nutritional intake is, has a huge role on cardiovascular health. If you have a lower sodium intake, so you're watching how much sodium you're ingesting, that can help out with overall blood pressure and cardiovascular health. If you have an increased fiber diet, it can also help with overall cardiovascular health. Increased omega-3, lower fat intake, all these can help out with your cardiovascular health, helping out with blood pressure and blood flow, and then overall tissue health. So cardiovascular disease actually has some roots based in how your diet works. Next one up is hypertension. Now, really, hypertension is chronic high blood pressure, but that can kind of go hand in hand with the cardiovascular disease we just talked about. That's because hypertension is also part of the cardiovascular system. Now, unfortunately, hypertension is one of the major causes of heart attacks and strokes. The problem here is there's really no symptoms, no signs that it happens until you get very highly elevated blood pressure. And once it's highly elevated, it's dangerous at that point. That's why a lot of times hypertension is referred to as the silent killer. There's really nothing telling you what's happening until it's too late, until there's really a problem occurring. But the only way to know would be to constantly check your blood pressure. Now, for any individuals that have elevated blood pressure at an annual physical or similar medical appointments, it might be recommended to check daily or check weekly or check monthly to kind of keep an eye on where your blood pressure is. So roughly 120 over 80 millimeters of mercury. And depending on what literature you read, it's 115 over 75, but in that ballpark. From there and down is ideal blood pressure. From that 120 over 80 millimeters of mercury up to about 139 over 89 millimeters of mercury. That's considered pre-hypertension. So it's not there yet, but we're in some warning range. We gotta be careful here. But then hypertension itself is 140 over 90 millimeters of mercury. Anything 140 over 90 or above is typically considered hypertension. Now again, that number might change a little bit of 135 or instead, or instead of 140, but it depends on what research you're looking at and which medical professional you're talking to. But if you're in the pre-hypertension or the hypertension state, one of the biggest things is to try and reduce your blood pressure. So that can be done by exercise, have a healthy weight, or just in general helping to follow the DASH diet. Remember, we talked about the DASH diet in a previous video. That whole diet is based on a reduced sodium intake. So again, your diet can play a role in what the hypertension is. Next one up is cancer. Now, cancer isn't one single disorder. It's actually a grouping of over 100 different types of cancers together. Now, cancer itself is going to be caused by a mutation in the cell, pretty much in your genetic material. This mutation then will prevent a cell, like a normal healthy cell, from healing itself. Normally cells heal themselves, no problem, keep moving, keep going. Cells have kind of limits of how far they'll grow. If they push up and grow this tissue and push up against something, they stop because they realize that's their boundary. But these cancerous cells, these mutations, they occur from either having hereditary, so genetics, or being exposed to cancerous agents, carcinogens. These carcinogens could be either chemical-based, could be viral-based, or a whole series of different things that can cause the mutation to occur. But these cancerous cells, they'll just grow and grow without any checks or balances. They'll grow pretty much uncontrollably. If they're growing and they push up against something, they simply just push it out of the way, or they keep growing right through it. Cancerous cells don't have the same checks and balances as normal healthy cells. So really, what are the risk factors? Well, tobacco, that also extends to vaping now. Alcohol, looking at obesity, looking at cooking techniques. This is where the nutrition comes in. Because grilling, smoking, can actually introduce carcinogens into the foods you're eating. So how does that work? Grilling, a lot of times you have those little charred edges. That blackened or charred edges could contain carcinogens depending on how it was created, depending on the food, and depending on the temperatures. Because a lot of times high level cooking, so high temperature cooking, could potentially introduce carcinogens. Red meats, cured meats, things like sausage, pepperoni, bacon, those also could potentially cause carcinogenic agents to be there. So how do you reduce the risk factors? Well, physical activity. Recommend at least 30 minutes of physical activity a day. Could be walking, could be running, biking, lifting weights, whatever works for exercise for you. The idea of a healthy weight. Now again, in previous videos we talked about not looking at the number, but what's healthy for your body. When does your body have enough energy? When do you feel good? What's well for your system? Looking at your diet. Primarily plant-based has been found to be a little more beneficial. If introducing meats, then the lean meats are a little better. And then lastly are those red meats. Plenty of fruits and vegetables. That way you get your antioxidants in, you get your phytochemicals in. All meant to help reduce the chemicals and problems in your body that can cause damage to your cells. And high fiber. Keep enough fiber in your diet. That one especially helps with the colon because you're nourishing the colon cells, reducing the chances of damage and colon cancer that way. So really, diet can play a part with a healthy lifestyle as far as trying to reduce the risks of cancer. And the last one of the chronic illnesses for this video, looking into diabetes. Now, diabetes itself is actually a type 1 and type 2 diabetes, but both of them are dealing with metabolic diseases of insulin deficiency. So let's start with type 1. In the case of type 1 diabetes, the insulin-producing cells are killed off by an abnormal immune response in your body. That's going to mean that the beta cells of the pancreas, the ones that produce insulin, those cells are being destroyed by your own immune system. By destroying those cells, that means you have a lack of insulin in your body. This means that that individual must have insulin injections as the only way to prevent the deadly outcome of what this would be. The symptoms can become very rapidly as an onset. You have hunger, not just normal hunger, but constant hunger, excessive thirst, excessive urination, and rapid weight loss over a short period of time. You say, well, hold on, weight loss if you're constantly hungry. The reason being is without this insulin being produced in your body efficiently, your cells cannot take up the glucose for energy, which means all that carbohydrate, all that glucose that's going through your system isn't being absorbed, just passing right through. And that's why the rapid weight loss, even though you're still very hungry. So what's happening is your body's trying to use fats and proteins. Now these fats and proteins are being converted into energy. The problem here is if left untreated, all that ends up with ketoacidosis. That's because you're building up ketones in the blood from using those proteins and the fats, which can become quite problematic in itself. So what are you going to do? Well, the diet itself is going to be a specialized diet now. It's going to be looking at what's being ingested and trying to compare that to the glycemic index. Looking at foods that are high in the glycemic index and trying to prevent those. Because any foods high on the glycemic index can cause a blood sugar spike, which could be problematic in trying to balance out. So just kind of keep in mind what the amount of glucose that person is eating. All right, type 2 diabetes. In type 2 diabetes, this really is the majority of all diabetes cases. The estimate's about 90 to 95% of all diabetics are type 2. This is more of an insulin insufficiency, or the fact that liver cells, muscle cells, fat cells just aren't responding to insulin anymore. So what happens here is it results in high blood glucose levels. Again, the blood glucose levels go up, it's not being absorbed, it's going right out of the system. So the symptoms here a lot of times are a slower and more gradual onset. Something that just doesn't pop up and happen quickly, but it's a gradual incline. You might start wondering what's happening, why are things changing, and start to trace it back to where it is. Because initially, when this all starts, the pancreas, those beta cells that produce insulin, they're going to try to produce more and more and more insulin. Well, they're trying to compensate basically. Trying to make sure that they're producing enough insulin so the glucose is being handled properly. But eventually, they're just producing so much insulin, they burn out. As they burn out, that means less and less insulin. Insulin is not being handled properly, and eventually, that individual will need injections as well. The insulin injections will replace the insulin they cannot produce. So type 1, type 2 diabetes. But there is a third one that crops up occasionally. There's also sometimes gestational diabetes. In the case of gestational diabetes, this is only obviously in pregnant women during gestation. The idea here is, as a woman's pregnant, her body is going through plenty of changes, but one change could be that insulin is not being utilized properly again. So the body ends up with higher than normal blood glucose levels. The insulin itself just is partially resistant. The cells aren't utilizing it. More often than not, though, this resolves after pregnancy. So from that onset of gestational diabetes to the end of pregnancy, a specialized diet is usually put into place and close medical supervision is occurring. The idea is to make sure that everything stays healthy, and hopefully once delivery of the baby occurs, goes right back to non-diabetes state. Doesn't matter if it's type 1, type 2, or gestational diabetes. Nutrition is going to play a huge role in managing all of these. Because watching the amount of glucose you ingest, watching for those high glycemic indexes, and helping to maintain a roughly level insulin level and roughly level glucose level. So a couple different chronic diseases is what I went through. All of them have impacts based on your diet. The diet can help to manage or can help to reduce risk factors for these diseases. Until the next video.